It's a typical day for the cancer staff here at the West Clinic. Busy. With a waiting list of more than 200 patients a day, physicians know that every minute of every office visit is precious.
What happens in a doctor's visit is you have 15 or 20 minutes to try to tell the doctor everything you need to tell them, and that's especially difficult in a cancer clinic because you're worried about your cancer, you're worried about your blood counts, you're worried about your next chemotherapy, so those are the things you're focused about.
Because of those worries and concerns, vital information can often go unmentioned. That's why many doctors are prescribing a new tablet for their patients. The eTablet is a notebook-sized wireless computer used to track a patient's symptoms. The idea originated here at the West Clinic and was developed by ATS Worldwide. Upon arriving at the clinic, patients use the eTablet to complete a questionnaire, rating their symptoms on a scale of 1 to 10 by means of an electronic touchscreen.
So by using an eTablet, a patient can give a detailed and honest self-assessment of his or her condition. The doctor reviews the information in advance, and that leads to a more productive and efficient office visit, and ultimately gives the patient and doctor more quality time together.
Yeah, I was looking at your eTablet, and it shows that you're getting progressively fatigued. You're telling us more and more of that. You think that's the chemo or what?
Lana Mason was diagnosed with cancer last September. Since then, it's gotten tougher for her to keep track of her symptoms.
Because the attitude at the very beginning is, I can do this, I can go through this, and I can win. But as you go further into your treatments, when it kind of wears you down a little bit and you start answering the questions, it's a little harder.
For patients like Lana, the eTablet has proved to be a vital component in their treatment. It not only cues the doctor toward specific physical problems that might be occurring, but it helps them focus on a patient's emotional well-being too.
I've never had a doctor ask me emotionally how I'm doing. You know, you might have a little bit of it, you know, do you feel okay? And you're like, oh yeah, I feel fine. But this says, are you down? Are you blue? Do you feel hopeless?
It keys me in to ask the appropriate questions. Your eTablet says you're kind of sad. Is there something going on?
Improving the quality of the office visit is only a part of what eTablet can do for a patient.
They have a whole array of videos they can watch to talk about chemotherapy side effects. They can get on websites to find out more information about their cancer, all while they're sitting in the waiting room.
And that's not all. The eTablet can also help reduce the stress patients feel by whisking them away on a virtual vacation.
It's set up where you can look at different pictures and you just press the eTablet and it takes you right there.
Already, plans are underway for information from the questionnaires to be used for research in more than 100 clinics nationwide. And it's moving beyond the field of cancer. Cardiologists are finding applications for the eTablets as well, which raises the question, could eTablets be popping up in your family physician's office soon?
It would be awesome. If it could, I think it would help doctors to be more efficient with their patients and to understand their patients a little bit more.
For now, Lana is content, knowing that thanks to the eTablet, the doctors and nurses here at the clinic are keeping a close eye on every aspect of her cancer treatment.
To come here and know that they remember you and they know you and that he will come in and ask specifically, knowing what's wrong with me besides my cancer. That's what helps. That's what means a lot.
For Smart Medicine, I'm Rod Starnes.